just welcoming everybody along. We're quite small number today, which is going to be fun. Means that we can have an intimate conversation. From our team, just like to say hello to Catherine and Mahika, who's now running communications for 4SD, and Catherine, who's our senior health systems advisor. And I'm very pleased also to welcome our systems leadership mentor, John Atkinson, who's here as well. Really great. Thank you, John. Very good. Now, I thought that rather than me block up the time now, I would go to Catherine to start us off, and going to suggest that when we reach the end, that Mahika ends the show. So over to you, Catherine, please.
So great. Hi, everybody. Happy Friday. I hope everybody is doing super well. It's lovely to see you all. And I see the room is filling up quite quickly. So we're really excited that you're all here. Hi to some of our old friends. Hi to the new friends. Hope you're having a lovely morning, afternoon, or evening. I want to mention, as always, that we are enormously grateful to have Peter Morey from Live Illustration here. Hi, Peter. Oh, hi. That's the cutest thing I've ever seen. Thank you for that on your illustration. And just to remind everybody that we are recording this. I know you already had to click an OK when you signed on, but we're recording it and we will put it onto the 4SD website. So if in the course of your comments, you feel like you say something that you don't want to have go up on the website, or you're concerned, just let me know, or Mahika. I'll make sure our email addresses are in the chat and we'll make sure that bit is edited out. In the meantime, I would invite you to put any of your thoughts or comments in the chat. That is usually what stimulates us to have David call on you. But David also just sees friends and people who sound interesting and calls on them. So don't be worried. We'll try to get in touch with you in advance of that and see if you're okay to talk. But if we don't, thanks so much for joining. David, back to you.
Excellent. Thank you. Thank you. I was just checking my various lists, and I'm super delighted to see that while we've been talking, the number of participants has increased to 33, and there are many, many people who come quite regularly. Why am I going around everybody and talking to some of you by name? I just want to stress that the way I see this is a community of people who come together regularly, who share, who grow through discussion with each other. Some of you are professionals working in management like Holly Wheeler, or working in health systems, working in international development, and you all bring different perspectives. And never was it more important than right now. And this is my focus today. What's the narrative that is going to help the world find its way through this pandemic to a point where it's no longer a public health emergency, and we can actually look people in the eye and say we're doing everything possible to do the best for everybody. There's a long way to go. The narrative is not right. So I'm going to start a little bit from, I think, where most of the newspapers in Western Europe are taking us to right now. You see, if you read today's newspapers in the UK, what's the main message where you find any reference to COVID? It's basically saying UK is going to end any kind of restriction on what people should be doing. The UK is going to stop access to free lateral flow tests. UK is going to discourage isolation of people who test positive for COVID, which I think for most observers is leading them to say, UK is basically letting go and saying, let this virus move around where it needs to move to. Let's rely on vaccination to stop this virus from leading to death in those who are vulnerable. and let us rely on high levels of infection of the population to try to restrict the impact of the disease on society. And there are other countries who've looked at the UK approach and are questioning whether they should follow it. There are other countries that are alongside the UK. And in fact, the number that are moving in this direction is increasing, with Denmark and Norway and Sweden, and to some degree Switzerland, all moving into a end restrictions and basically let the virus move around approach. But there are other parts of Europe where things are much less relaxed. Italy is still quite strong on trying to prevent spread of the virus. So is France. And I think that it's quite interesting to ask the question, why is there a difference between countries where there's a lot of public health knowledge? What's led to some countries really quite actively reducing activities that will restrict the spread of the virus, whether other countries are still treating it with a lot of respect? I think it's for me at least, impossible to explain. I, as somebody who trained in public health in Britain and practiced public health around the world, I can't explain to people I know what has led the UK to adopt such an outlier strategy. But I've talked about it last time a little bit, and I want to talk about it a bit more today. But I also want to tell you what I would be doing if I had responsibility, because it's not what's happening right now. And I think that there are aspects of current practice which are potentially quite unhelpful to people, not just to people in the UK, but also to people around the world. First of all, the virus is continuing to circulate. There's no way in which anybody of us should be saying to others or even to ourselves that we are near the end of the pandemic, nor can we predict a date when it will end. It is not possible to forecast with any accuracy. And if there is forecasting going on, then people are usually doing the forecasting on the basis of assumptions. The Omicron variant is dominant, but it will not be the last variant. Indeed, there are already variants of Omicron moving around. Thirdly, the way in which you prevent this virus from being spread is through actions that make it hard for it to move from person to person. And that does mean wearing well-fitted face masks. It does mean maintaining physical distance because of trying to reduce transfer of droplets from person to person. And it does mean also good hygiene and ventilation. At the same time, it's important to protect people from being infected and to protect them from being ill if they are infected. And the best way to do that is through immunization. Immunization is great because it means that if you are infected with the virus, you are much less likely to become severely ill, and you are much less likely to die. And evidence that came available to me last week is suggesting that the vaccination does reduce also the incidence of long COVID. So if you're immunized, the current hypothesis is that you're much less likely to get long COVID as well. So the vaccines are great at protecting people from getting nasty consequences of illness. What they don't do is stop transmission of the virus. And that's super important to remember, that the only techniques we have available right now to stop transmission of the virus are those things we do to make it difficult for the virus to move from person to person, which means wearing masks, it means maintaining physical distance, and it also means isolating if you know you are ill. And that stops the virus from spreading. Quite traditional, but it works. And then the third and last of the three big things I want people to do is to prepare for surges, because we know that this virus appears in big surges. And when there are a lot of people who are vulnerable, for example, some months after the previous surge, the numbers who are vulnerable will increase. And then you get a big buildup in cases and hospitals get overloaded and people start to get very sick. So there are those three things. Prevent transmission. How do you do that? Masks, physical distancing, isolation when you're sick, good hygiene, and ventilation. Second, protect those who are vulnerable, particularly by vaccination, but also sometimes by shielding them. And in many people I know, they are combining shielding with vaccination. And then thirdly, prepare for new surges. Nothing here in my words about the pandemic being nearly ended. And you can say, well, David is talking about living with the virus. Yes, he is. But for David, living with the virus means putting in place the necessary defenses and the necessary shifts in how we behave so that this virus, as it's moving around in our societies, causes the minimum degree of unpleasantness to people and to communities and to whole nations. So one or two things in my little account just there are still a bit troublesome. For example, I say that the number of people who get ill when you get a surge building up depends on the amount of susceptibility in the population. And of course, susceptibility is the degree of susceptibility is reduced if people are immune. But immunity after infection, immunity after vaccination wears off. And it wears off more quickly if people are challenged using a variant of the virus, has the capacity to bypass the immunity that we have. It wears off more quickly in older people. It wears off more quickly in people who've got difficulties in their immune systems. And that means it's really hard to come out with standard generalizations on what is the time after immunization when people are at risk. Answer depends on a huge number of variables. And that makes it really hard to give precise statements to decision makers about whether they should be giving extra boosters or how long after immunizations have been given should they be encouraging people perhaps to go back to wearing face masks and physical distancing. They are very imprecise, the bits of information we have, but that's what we have. We don't have cast iron figures on duration of immunity. We don't have cast iron figures on the protectiveness of vaccination against the different variants of Omicron. And so we have to build into any response strategy the extra capacity that's needed to cope with our uncertainty. And we have to build in an awful lot of humility. We have to say, this is what I think. This is what I suspect. But we have to be super careful to avoid language like, this is what will happen, this is what we know. Or even worse, language that implies that anybody who thinks differently from us is somehow not just wrong. You've got to be a little bit careful on implying that anybody is wrong. So everything I say in these briefings is what I think is happening and going to happen. So to summarize, the virus continues to circulate. The pandemic is not ended. Omicron is dominant now, but it's not the last variant. We should not be letting down our guard. We should be doing everything we can to prevent transmission of this virus. We should not be letting down our guard. We should be doing everything we can to protect people who are going to be affected by this virus. We should not be letting down our guard. We should be doing everything we can to prepare for more surges of disease. And we do that through building up local capacity, ideally built around district public health officers or other district personnel who have an understanding of the principles of infection control and public health. These people should be systems leaders because they're working with lots of different groups and trying to support them as they come together and develop a shared strategy and response protocols. But perhaps most important of all, it's the style with which we do it that really matters. People are partners in the response. The virus is the problem and people are the solution. Now, you've heard me say that before, but I want to say it again because I think that it's more important now than ever. If people are the solution, then I personally believe that it is absolutely essential that every leader focuses on ensuring that her or his decisions will strengthen trust between people and authorities. And when I talk about this, I mean strengthen trust between all sections of society and authorities. So don't ignore perhaps small sections of society who are in a mistrustful state. Remember that because people are the solution, that actually everybody needs to be able to start trusting those who are providing them with directions for the response. Because a small number of people who mistrust and who perhaps are resentful about the behavior of those in authority, if they get sufficiently angry, can actually mess things up for everybody. I mean, we've seen this countless times before on other issues, but we're seeing it now in response to COVID. And so I'm now ready to start saying to people straight up, looking them in their eyes, please avoid compulsion when it comes to responding to this virus. Please avoid anything that makes individuals feel that they are compelled to undergo health procedures or to adopt particular changes in their behavior to the point that if they don't do so, they will be penalized in a way that can affect their standard of living and their sense of self. And then I go further. I say, please avoid stigmatizing people who are not comfortable with accepting the majority behavior. So I just got a buzz on my phone, but I've got quite clear on this in my own mind. And I'd always thought it, but now I want to say it, that I don't actually think that compulsion has a place in dealing with this virus right now. Not the compulsion that leads to groups of people feeling that they actually want to go out and assault and perhaps kill public health professionals or leaders who are acting in the interests of public health. I just don't think it's worth it. And I want very much, if anybody wants to discuss that, I'd like to discuss it. But we're not too late to walk back from the anger that is now characterizing an awful lot of what's going on this pandemic. We're not too late. And do you know why I think this matters? Because I said it earlier on, there'll be other variants. And some of these variants will be nastier. They'll either affect people differently or they'll affect people in a more extreme way. And it will be necessary at some point then to ask people to change their behaviors more substantively, to ask people perhaps to go back to wearing masks after they've been encouraged to leave the masks at home. And if that's the case, we really do need, as public health professionals, to be in a position where we can level with different sections of society and indicate to them why it's going to be necessary to go back to adoption of public health and safety measures. And if the trust has broken, perhaps because a small segment of society has got sufficiently agitated, they've started a civil disobedience, which is affecting a lot of people, then that's going to make life very, very difficult. So from my point of view, doing everything possible to reinvest in trust, to build and sustain trust is the key. Those are my remarks. I see Maria Van Kakova is here, and I hadn't noticed till I just saw my phone that you're here, Maria. I'd like to invite you to take the floor and share your thoughts and reflections. And I'd like to do that now before we move to getting other people to join and we look at Peter's picture, because I don't know how quickly you're going to have to go off. Maria Van Kakova, Chief Epidemiologist, COVID Response Team, WHO Health Emergencies Program. Welcome.
Hi, David. Hi, everyone. No, I joined and I listened to your overview, which I, of course, agree with wholeheartedly. I mean, I think you all know the situation that we're in. You are watching the same numbers I'm watching. The concern I have is around these false narratives that we have. It's not only the anger, and I think there's a lot of anger out there. I have to say, I have some as well, and I'm sure you do too, David. But it's what we do with it. And I think to myself every single day, what are you going to do? You know, are you going to get out of bed and get to work and leave, you know, before your kids wake up, and sometimes, most times, get home after they go to sleep? What are you going to do in using the position that you have? I'm in an extremely privileged position at WHO, which I'm really grateful to have. I'm really grateful to work with amazing WHO staff in Geneva, in our regional offices and our country offices, to work with literally thousands of scientists every single day on trying to do better in this pandemic. And it's never too late. But I wonder also, I mean, you are talking right now to an amazing group of people, and I know each and every single one of them are doing what they can to bring us closer to the end of this pandemic. And I really think we have to remind ourselves how important that is, and we can't give up. So the narratives that are out there, that it's over, that it's mild, that, you know, it has become the common cold, or it'll just eventually become the common cold, or it'll eventually become flu, I think are incredibly dangerous. And I think this is fueling the confusion that's out there. The numbers of cases are declining. Let's say the numbers of reported cases are declining, but let's not fool ourselves. Testing strategies and the amount of testing has decreased significantly in a number of countries. So I don't believe those trends in terms of reducing numbers of cases of Omicron. I don't think they're actually going down. What's more concerning to me is 6-7 weeks in a row, the increasing deaths. Almost 75,000 people died last week that we know about. And it's far, far higher. And if you have a decreasing trend in incidence and an increasing trend in mortality, there's something wrong with your surveillance systems. Or, you know, we're really seeing a shift in this virus, which we're not actually seeing in the data. So Omicron are these 4 variants: BA1, BA1.1, BA2, BA3. BA.2 is increasing in prevalence and in detection, let's say, around the world. Yes, this is the epi curve that you see here. Again, I mean, I'm so struck by looking at this epidemic curve that I look at every single day. That line The black line is mortality, it's deaths, it's reported deaths. And that it's hard to see on the screen there, but it's a sharp increase in the last 6 weeks. We shouldn't be seeing that at the present time. The case numbers mean, we've had to redraw the scale, and it looks, our other peaks that we've all gone through, that each one of us has gone through, look almost flat. So it's shocking to me every time I look at it. But I think, what do we need to do? I could tell you what we're doing. When I say, what are you going to do every day? I could tell you what we're doing. We're keeping our head down. We're keeping focused on the science. We're keeping up all of the collaborations and encouraging our partners around the world to continue to do more studies, to share those studies, to do sequencing, to do the lab studies, to do the clinical studies, to share the clinical data, to report to us, to report to the world, so that we are still tracking this virus. We're not giving up. And what we are also doing is we're also using this situation right now that we're all in, and we're exhausted as well, to evaluate what needs to be done in the long term. So we're all still fighting this acute event, this emergency that we're unfortunately still in. We're talking to governments about how do you use this traumatic situation to build systems better. Not enough countries are actually doing that. We're also doing that ourselves. What do we need to think forward in terms of how do we deal with respiratory diseases? I know you say that people are learning to live with this virus, but we need to learn to live with it a hell of a lot more responsibly. We're not being responsible. Abandoning measures and lifting everything all at once in many countries is premature and it's dangerous. I don't understand for the life of me what is so difficult about wearing masks. I really don't. I'm sorry. I'm still traumatized in the beginning when we didn't recommend immediately everyone on the planet to wear a mask. We recommended from January, everyone who was sick to wear a mask, everyone who was caring for someone sick to wear a mask, but we didn't do a blanket wearing of a mask. We still don't, in fact. But we encourage their use. We know that they work as source control. We know that they protect vulnerable people. So this is something that everybody can do. And I think if we learn, as we are learning to be more responsible with this virus, a lot of governments are putting the responsibility once again in the hands of individuals. And people are very smart, but they need to be able to out these life-saving acts and be supported in doing so. So I think for me, it's about what are we going to do every day? What are you going to do every day? And how do we get us closer to the end than towards the beginning? We're looking at different scenarios going into the future. Variants are the big wild card in terms of what may happen with the virus itself. The virus is evolving. There will be more variants. We are seeing an increase in this BA.2. So far, the clinical data that we see in people, we're not seeing a different shift in terms of severity. We don't see a change between BA.1 and BA.2. There's a preprint that came out from Japan that's gotten a lot of attention. It's a study in hamsters looking at pathogenicity, and maybe there's a signal of a increased severity, but it's a study in hamsters. We are discussing it. We don't want to jump to any conclusions because we're not seeing it in the clinical data. But again, Omicron's not mild. So again, we're really kind of focused on what needs to be done now and into the future. And I think the last thing I just want to mention is around trust. Trust is at an all-time low, as you all know. And the question is, how do we rebuild this? I don't think at a global level, we're doing a good job. I think that we're really, leaders are confusing matters. People out there are speaking with such certainty. I think the last point you said of speaking with certainty, I'm really struck by that in the last couple of weeks. But there's a lot, we're in a massive period of uncertainty. I just saw a question pop up on the screen asking why WHO doesn't recommend that. What I mean by that is we don't recommend everybody wear a mask everywhere all the time. What we recommend is the use of masks. It depends on where you live. I mean, in many situations, transmission is really, really low. So in those situations, you can lift the use of masks outdoors, for example, are hanging off the side of your face. certainly in health facilities, and certainly masks and respirators for medical workers. But it's not a blanket all or nothing. And I think this has been a problem. I was struck recently in a conversation where we were talking about these false dichotomies, and someone brought it up as if it were a new concept. This has been a pandemic of false dichotomies: containment versus mitigation, airborne versus not airborne, masks or no masks, severe or not. It's all of the above. It's airborne, it's droplet, it's contact, it's all of the above. But you have to nuance these messages so that we engage people to give them the information that they need to keep themselves safe. We'll keep doing that. We are imperfect. I am certainly imperfect, but we keep coming back. So maybe I'll just leave it there with you. But I think we're in a dangerous situation right now. This pressure, political pressure to get on with it and move on, is extreme, and we understand that. But at the same time, we're asking governments, we're asking people to be careful. This virus is still dangerous. This virus has a lot more room to move. The intensity by which it has spread means that we will likely to have more variants. We are now starting to see new reservoir, the virus going into animals and possibly passing back into humans again. We really need to be careful. We have literally changed the ecosystem of the planet with this virus. And so let's just do what we can to keep ourselves safe and our loved ones safe. And I know that means that it's the responsibilities of individuals, but we need to help governments and people and communities and spiritual leaders and scientists. We'll just keep at it. So back to you, David.
Thank you very much indeed, Catherine. Thank you very much indeed, Maria. Catherine, I'd like to ask you, please, if we can just be sure that we've got the right selection of people ready to be called upon to speak. And you've kindly sent me some messages. What I'm going to do is people who would like to speak, to comment on what I said, particularly to comment on what Maria just said, if you want to get our attention, please wave quite actively like that, because I want to make sure you get a chance to speak. We don't get Maria here very often, and it's rather special. And I see that many of you have reacted to what she said. I'd like to ask Claire Rayner to speak first, because you for me are one of the champions of the movement of people who are drawing attention to long COVID. I made a remark this time about the early suggestions that immunization may reduce the risk of long COVID. That doesn't mean that I want to belittle the enormity of the problem of long COVID with so much infection around in the world today. Any thoughts you've got today, Claire? Over to you.
Today on, just to respond to that, I mean, thank you so much for your words, Maria and David, just your very human words. I think they've really touched me, thinking about anger but at the same time, keeping going. It's really tough situation we're in. So regarding vaccines, yes, I believe there's some indications that the rates of long COVID are less. And I share your proviso, really, that it doesn't mean it won't happen. I think what concerns me at the moment is the sheer numbers of Omicron, which will still mean sheer numbers of long COVID. There's something different coming through to me as well. And that is that younger people seem to be getting blood clots. And they seem to be more obvious. So there are strokes in younger people, and surgeons are reporting large numbers of blood clots to parts of the bowel. And this is later on, other than in the acute stage. The other thing I want to say is that those people who are 2 years into being very, very ill are in a desperate state. I literally can't tell you how many people I know who are fading away at home. And this really concerns me, because I think there's something really, really going on with them. And then thirdly, people are losing their jobs left, right and centre. And our health systems are completely overwhelmed. If that's really all I had to say, but I would love it if I could introduce Sammy McFarland, who has set up Long COVID Kids. We are desperately concerned in the UK. The pictures of the problems that I'm seeing in children. So I'll be really grateful if Sammy could say a little bit about that.
Sammy, you have the floor to talk in whatever way you want.
Thank you very much, David, and thank you, Maria, for everything you're both doing and everything you've just said. It's absolutely inspiring to hear you be invited to here today. So I set up Long COVID Kids. My daughter and I got ill in March 2020, and I was told that if she was more positive, then she would, and she spent more time with her friends, she would get better, and she was mimicking my symptoms. And the anger that I felt from that, I channeled into creating the UK's first and international based charity for children living with long COVID. We now have nearly 10,000 members, and we welcome about 200 a week. The families that are coming in are tragically having the same experiences that myself and my daughter had 2 years ago. Nothing has changed, nothing has improved. The challenges of getting any help or being believed are equally as catastrophic as they were 2 years ago. And I'm extremely concerned that I'm just not seeing the children that I've now been observing for 2 years. I'm not seeing them getting better. And what I hear is that the ONS data that we have in the UK, reports on 3 months and then at 12 months that there are a lot less people ill, but I'm just not seeing that in our support group. What I'm seeing is that children are being fitted with feeding tubes and the tubes are not coming out. I'm seeing children who have lost the use of their limbs and can't walk and are immobilized and in wheelchairs, if they can get wheelchairs, and if they're housebound, if they can't get wheelchairs. We're told that our children have anxiety, and we're told that our children have depression, and we're told that they need to try harder and we need to be more positive. But what I see in my group is families who have given up their work because they have to be now full-time carers, who are spending their time looking after these children and researching, and we've become researchers and we've become home scientists and doctors trying to understand what's happening to our children, and not able to find an answer and not able to get support. We're seeing a huge increase now of self-harm in the group, not because these children have anxiety and depression related to the pandemic, but because these children are being told that their symptoms are in their head and they're not getting any help. And I would just like to ask everybody to really think about how you can raise awareness about what's happening to children, because in the UK, we don't have any mitigation. There's no mask wearing. Most of our children have not been vaccinated, and we've only just now this week been told that the younger ones can be vaccinated starting from April. I don't understand why there's another 6-week delay. We've got very low uptake in children because there's never been any messaging about how COVID infects children. In fact, what we're told is that COVID is a mild illness in children. And for most of our children in the group, that's true. It was a mild illness. They were never hospitalized. But what happens in the next 5 to 6 weeks after is they often have a period of recovery and then they get sick and they're not getting better. Thank you.
Sammy, thank you. And I think what you have said will be heeded and heard by everyone. I think that people will be feeling saddened by it, but they will also feel inspired to act. And I want to keep the thing on long COVID, and I'd like to include in that anything that you've been looking at or picked up on about the long-term impacts of COVID, for example, cardiovascular incidents and so on, more common in people who've had COVID compared with people who haven't. And also, if you want, focus on the impacts of COVID on people's lives and lifestyles, incomes and job security. Because just right now, having just had a conversation with the United Nations in the Caribbean, they're telling me that what we have expected and talked about in these sessions before, about how COVID is widening the gap between those with wealth and those without wealth is very much being borne out right now. They have an epidemic of poverty and of suffering and of mental distress and of malnutrition, all linked to COVID and the way in which COVID is handled. Okay, so any reactions to any of those points? I would like to come back to Maria in a second, but I want to see if anybody else wants to talk. Claire coming back, and Claire, if you want to bring anyone else in, please do so for one more input on long COVID.
In answer to your questions, that there's significantly higher rates of all forms of cardiovascular disease being found in people with long COVID, which I anticipated because it really is a vascular problem. So we're seeing the paper recently published in Heart on that, a big one, meta-analysis. So absolutely, definitely. Effect on finances, people are now losing their jobs, have lost them. Heating bills, I mean, gosh, I feel so bad talking about it in Britain compared to other countries, but you know, there are some people who are on, let's say, £500 or £600 a month because they're still ill, and that's what they receive in benefits, and their monthly heating bill is £350. So those are just examples. Yeah.
Thank you, Claire. Very much indeed. I'm looking around, any hands going up? Peter.
Sorry. Yes, thanks, David. I wanted to mention, because both my sons are clinicians. One is in Norway, and although he thought he as a GP, he was going to avoid it, he's actually got an epidemic in his village. His own family have got it. But he's still very laid back about it. And my other son's an anaesthetist in Devon. And what I'm detecting is amongst the clinicians, they are fairly laid back. So maybe we need to get more information out about long COVID, because obviously I hear things, and we need to get to the clinicians, because they're swallowing the propaganda, I think, that it's all over and long COVID is, you know, something that'll wear off and happens so rarely, they don't need to worry about it. Anyway, that's what I was going to comment, but I will just come in and say a bit about what engineers are doing to try and help. Last time I talked about us developing a better mask. We're pushing on with that, but we need as much support as we can. Basically, the aim is to make one on the same machines that make as surgical masks, but a lot better, filters better and leaks less. Because we can then produce huge volumes and get them out there. The second thing, and we've had a very useful conversation with Hong Kong and the Far East, because they did do very much better at the beginning of this pandemic by much quicker reaction and indeed wearing masks, but everywhere it mattered, and involving the kids as well. Same problem as vaccination. They said any kid over 2 wears a mask sitting down in school, things that we took a very long time to get around to. Anyway, the next thing, so just two other things. One, that what we're trying to do is come up, they are very much more advanced in what to do in buildings, and indeed in better guidance. So sorry, I hope that's helpful to everyone.
Very kind of you. Thank you, Peter. Sammy McFarland, and then if Maria's okay, I'd like to bring you back in again, and then we will move on and talk a bit more about leadership in response to the pandemic and getting some comments from around the world. Sammy, please.
Thank you. I just wanted to say about education. So for the families that are caring for their children, they're not able to work because you can't send sick children to childcare. So they're losing their jobs. And the impact now is, you know, families who were professional workers are accessing food banks. But from an educational point of view, children aren't able to access education because they can't leave the house. They are not able to concentrate. They're not able to sit up long enough to be in school, and these are huge problems. So we need to really, I'd like to raise awareness that we need education policies, and this is so important because the mental health, the long-term mental health, as we all recognise, of children that are not able to be in school, it is further compounding the symptoms of long COVID. Thank you.
Thank you very much indeed. There was a question in the chat, Sammy. I think it was, what is the name of the group that you've set up? I think it's called, I wrote it down, Long COVID Kids or something. Is that right?
Yes, Long COVID Kids.
Brilliant. And so the email is longcovidkids.org or org.uk or something.
It's longcovidkids.org is the website. And if
you.
anybody needs to email me, it's sammy@longcovidkids.org.
Brilliant.
Thank
Sammy IE, everybody, just taking it off your name on your thing. Thanks very much indeed, Sammy. You are always welcome at any of these sessions. Lovely. And solidarity, I mean, it's not lovely what you're talking about, but it's lovely that you're here. And thank you, Claire, for constantly bringing this issue up. I wanted to invite Maria just to make one more comment and then obviously let you go and get on to your next thing. Maria, please.
Thanks, David. Thanks, Claire and Sammy. I mean, what you're describing is just heartbreaking. As a mom of two little kids, 11 years old and 3 years old, I can only imagine. I'm really not really fully comprehend the difficulties that you're going through. I think people are really only starting to understand and recognize that long COVID is real, despite your amazing groups and advocacy from the beginning. We've been engaging since the spring of last year, really the summer of last year, and trying to set up programs to ensure that there's recognition of this, that it's real, with a case definition, with a definition that is imperfect, but it's at least something that can start with advocacy, with understanding, with setting up studies so that we can properly understand what long COVID is, how we can, the extent of it, the breadth of it, the body systems that are affected by this, the age groups, and we really don't have a good understanding yet. What you describe is what we are hearing. We're hearing from around the world. We know that children could always be infected, can be sick, can die, and can have long COVID. And it's heartbreaking that people are really only starting to become aware of this, or not become aware of this. That's the wrong phrase. That are starting to appreciate that this is real. But I think for us, what we also need to ensure is not only that there's research, recognition, rehab, which is what we've been asked, to support, but it's making sure that the care is provided now for anyone that has been affected by COVID-19, and that we have the systems in place to provide that care at national, subnational, local levels. I think the comment about, education with medical professionals is an important one. We hold a number of seminars which are targeted towards medical professionals, not really the general public, but towards medical professionals. We have several coming up in the coming weeks. I'll make sure, David, that you have the links to those and we can maybe share those more widely and get people registered for those. But I think there's a hell of a lot more work that needs to be done to understand this. And I'm just sorry, to hear about all of these kids that are suffering from this and the families, because it's not just individuals and that's bad enough, but it's you who have to care for them and watch. So I think we can also work on, as I'm listening to you, we can also look at, is there ways in which WHO can support governments or in helping families deal with people who are living with long COVID. And maybe there's something we can do there as well. But I think you reinforce that we can't give up. You reinforce that everything that we're hearing right now seems so awful, but there is a lot of good that is out there. There are a lot of amazing people that are out there. There are a lot of people that are turning their frustration into action. I'm one of them, I hope. But these gaps that we see, David, that you just mentioned, the widening of the gaps is real. I mean, it's significant, and it's getting worse. This is all over the world. So another reason we really need to bring this virus to its knees. But we're going to keep at it. So thank you for the work that you're doing and the support that you give to parents and patients and families. And we'll keep at it ourselves. Back to you, David.
Thank you. Maria is not exceptional. Most of the many brilliant professionals at the World Health Organization are like her. They're people who care. And they care so much that they drive themselves immensely hard to a point where they get super tired, but they don't stop. They go on because that's the point. The need is still there. And if you stop, you're letting people down. Maria leads the team that works on everything to do with the pathogenesis and the clinical treatment, and of course, all the long COVID work. And this person who's with us today, who's given up her time to join us, has single-handedly made absolutely certain that this issue is taken seriously by the WHO. And several of you, I know, have been participating in the groups that have been looking at it. Thank you, Maria, on behalf not just of us, but on behalf of the hundreds of millions of people in our world who depend on you right now. Thank you. I'd like just to go and spend a minute thinking about the kinds of leadership that are needed right now to pull us through this. And I wanted to ask Alejandro Alcantara, who is joining us from Vancouver, if he wanted to talk about that at all. You may feel you're put on the spot, but it's your moment now if you want a couple of minutes just to explain why this is an issue that fascinates you so much.
Well, thank you and hello to everybody. I've seen a number of Canadians there, so I'm very happy to see that. So from my perspective, I just wrote a little thing here, not thinking that you were going to put me in the spot, but I was thinking, I was looking at leadership from a broader perspective, not just from the perspective of public health or global health. And what I find is that short-term gain often overrides long-term gains, like getting rid of the pandemic, like Maria said. And from that, we have different moments and different opportunistic leaders at different levels that take this opportunity to say, oh, the pandemic is ending, the pandemic is over, we're going to lose votes, let's change the dynamics. And with that, we get situations like what we have today here in Canada, which is that the political discourse has changed from the pandemic and all the people that are dying and getting sick or are going to be sick for a long time, and trying to protect them and to resolve that to a discourse about freedom and rights, to the point that the government has instituted emergency protections because of the severity of what's going on here in Canada. So I mean, obviously this is at the highest level. There's also everyday leadership. How do we interact? And you guys have, and ladies and gentlemen, have really made a lot of different, given a lot of different examples of how to do this. And so leadership, from a systems approach and from a systems approaches, is a very multifaceted thing and at different angles. And I think that venues such as this one really provide an opportunity to take stock. And to look at how can we connect the dots behind the scenes, and how can we think beyond our realms, which is really important, because the science and the knowledge is very good, but everyday people are just wanting to get on and move on. So how can we as leaders, how can we decode that and simplify it, and so that decision makers know the devil's bargains that they're making by shorting or attacking, protecting their societies for short gain, and how our individuals, everyday leaders of their own reality, falling prey to those type of seductive, simple narratives that the pandemic is over. So of course, it's a complex issue, and one of the things that we're doing in the coming future with David is actually looking at how leadership can be, what are the themes and what are the topics that are out there that are important for leadership decision making. How can we summarize them and put them together in a document, and how can we discuss this with decision makers, and how can we make this something that to some extent can help facilitate the thinking around decision making and leadership, of course, from systems leadership. So with David, we will be working with on this. Thank you.
Okay, now Holly Wheeler, if you're here, I saw you earlier, but you might have slipped off. There you are. If you want to turn on your microphone, now would be a chance for you to reflect on the leadership challenge in the health sector and beyond. Okay.
Hi, David. I'll give it
Hello.
a go. I'm afraid it's half term and I'm in a very noisy place.
Well, thank you
you
for
hear me
joining us.
okay?
Yes. It's
Okay.
great. Thank you.
So I guess when I heard you talking earlier, what I was thinking about was, how do you be confident about the uncertainty so that people can see that we're not needing for heroic leadership right now. What we need is someone who explains what's happening and is clear about what's happening right now, and people who say, this is the next thing that we think will be helpful, so that people can see that there is a direction of travel. So I know what I need to do as an individual, we know what we need to do as companies, we know what we need to do as a collective to support each other. Because my sense is at the moment is that there's not an understanding of how we can act together, and that acting together is helpful to all of us, helpful individually. And I heard you talking about trust earlier, and Maria was talking about trust being very low. And part of that is, I think we feel very disconnected from each other and disconnected from our leaders and decision makers. And some of that is the history that we've had over the last 2 years, and I think the lack of understanding about what it's like for different groups of people. And I think that we need to encourage our leaders to take up the aspect of leadership. Like, it's a courageous thing to do, to say, this is where we are now, and we don't have all the answers, and this is the next thing that we need to do to help, and this is how we're learning about what we do next. I do think it's really difficult, and I think the leadership that people in positions like yours and Maria's has been brilliant in saying, we're learning, we're doing the next thing. And what I'm seeing at a local level with public health leaders and leaders of health services or social services is a need to support them with empathy and sympathy about the difficult situation they are in, because there's a lot of pressure on them to deliver and quickly. So I guess as individuals who have interactions with those people, to keep supporting them to be vocal and understanding the difficulty they're in is really important, because everybody needs a bit of kindness in order to be courageous. So those are my reflections at the moment.
That's a nice one for everybody to chalk into their little memory patches. Everyone needs kindness in order that they can be courageous. Adrian McCord has commented in the text. That's great. Now, typically I go towards the end to John Atkinson. I said he was our leadership guru. You've heard Alejandro, Holly, and now John. Would you like to give us your own capsule of really what we can all do to support the kind of leadership that's needed to get through the current phase of this pandemic?
I think the thing to remember for me in all of it is that we're dealing with something that's really quite complex. And the nature of complexity is you can't reduce it to simple polarities. You can't say this is good or this is bad very easily. Every time you, masks, yes, no, what's the circumstance? What's the setting? What's the prevalence? And every time you do that, you create your problems for yourselves. Every time you reduce something that's complex into a simple thing, you leave out more than you bring in, and that comes back and bites you. You give disproportionate voice to very angry minorities, and it's felt like that's a common thing. So the challenge for leadership in these circumstances is the ability to hold and not allow to disappear the difficult questions that are raised, and to address that through changing perspective. And two ways of changing perspective that are really helpful are to change our perspective on time and to change our perspective on space. So we can ask, what's happening right now in this small place I live in? What's the level of disease? What's going on? Who's got what? How do I know? And I can ask, what's happening globally over longer time periods? How have we got to where we are? And what's the implication of that for where we might be going? And then that allows me to make different decisions about the things that I might do, because I'm not stuck in a sort of middle ground compromise that says this is what's happening in this country. Because I think, David, the thing that we've seen over time through this is that nationalism is really a pretty pure approach to dealing with a really quite infectious and dangerous disease.
John, thank you for stressing that it really does help to go global to local, to global to local, to remind ourselves all the time that although action is often so local, the global context really matters with this thing. And that's what I felt you were trying to get at. Is that right, John?
That's absolutely it. And also the local really matters. What's happening right here in my place may be very, very different to national statistics, national mood. And that should inform my choices as an individual as to what I choose to do, where I choose to go, who I choose to meet, how close I choose to get to them, all of that sort of stuff.
So although we ought to be stopping by now, I do want to note that Scott Knox has written something in the chat, and we've talked Canada, Scott, we've talked about influencing people. You're working in Canada, you are involved in that profession that has a lot of influence on what people think and how they behave. How do you react to this last part of the conversation?
Yeah, I think, and I put in the chat, I think John's absolutely right. Simplifying things down to narrow messages is absolutely right. The problem is we live in a society where that's very difficult to do, because everything's about a tweet, everything's about clickbaiting by news organizations and social media outlets in order to drive up ad revenue. And, I think the fair thing to say here is, and I'm going to get political for a bit, but if you look at the rise of Trumpism, that was on the back of actually condensing narratives down to bite-sizable chunks. And it's forced us who want to have a different perspective, a different point of view, whether that's about COVID or whether it's about another piece of liberal politics or whatever we want to say. We are forced into an arena of sound bites of small, chunkable sizes. And until we get control of social media organizations and news organizations that facilitate this being pumped out and out and out, that we have to decide how we deal with it. And I'd like to think that leadership can be about, having those conversations on complicated issues and not making it small. The problem is our lives are drenched. We have cognitive overload on bite-sizable messaging all over us. So we have to work out as leaders where we work. And that's why I asked the question of Maria about the idea of having a mask mandate. The problem is you could go down the line of, well, if and here and Trump, and let's look at it in a broader narrative. And for this wonderful group of predominantly healthcare professionals and, right-minded thinking individuals, that's fine. But for the people sat in those truck cabins in Canada and people sat advocating for tearing up masks, the unfortunate thing is the wider the narrative, the more they can put their own narrative about why it's about freedom over the top of it. So I do sometimes wonder that the clearest thing to do is to go mask mandate, full stop.
I see.
because it achieves the result.
Mm.
This is complicated, but the thing we cannot ignore is while we may want this to be fair and open and wide dialogue and wide leadership, we're living in a world that does not facilitate that happening, and too many vested interests on bite-sizable nonsense and misinformation traveling and driving up ad revenue. It's just difficult to do.
Thank you very much indeed. That's very, I mean, it's great that we're having these debates. It just shows these issues are supremely complex. I'd like to go to Mihika now to give us the closing sequence, and then we will come to an end and meet again in 2 weeks' time. Thank you all very much indeed for a really riveting conversation. Thanks to Maria, who's gone now, for just being with us and really giving us an enormous ray of sunshine through our discussion, and for me at least, a lot of purpose. And thank you, Scott, for challenging and asking us to rethink. Thank you, Claire, for bringing colleagues along, and Sammy for your witness. Thank you, Peter Hebert, always for the way you are. Thank you, everybody who's put comments into the chat. And thank you, Catherine Deland, for your leadership. Mihika, you have the floor now.
Thank you, David. And thank you so much, everyone, for sharing your stories, which really in this time of uncertainty highlights the importance of having a platform like this one for open, honest dialogue. And thank you so much, Sami, as well, for sharing information about your organization. And like Maria said, for turning your frustration and the frustration of so many others into action. I mean, misinformation and mixed messaging these days and the lack of an individual sense of agency makes it more important than ever that people are not just put at the center of decisions, but like Ian Boyd said in the messages, that they perceive themselves as part of the solution and feel a sense of shared responsibility to view themselves as partners in the response. And then just to end, to reiterate what Holly said, really, that what we need is a kindness and empathy so as to leave no one behind. Thank you, everyone, for attending. Back to you, David.
Thank you. Could we see Pete's screen, please? Pete Morey.
Hello, yeah. Oh, there we go.
Yeah. I mean, I just always like to give you a chance to say something about what's on your picture.
Okay. Well, thank you for having me. And I was trying to maintain the nuance, so it's quite a complex picture. As I followed the discussion, I guess dead center is the virus is the problem and people are the solution, which is something I pick up on a lot when I attend these sessions. And then directly below that, there's the build local capacity point, which moves into leadership points. So here we've got the local capacity being an example being local public health officials, and then we've got this build trust at the bottom with a nice line that came from the chat: compassion over compulsion. And then to the right, in smaller and smaller writing, as I was trying to capture all the great insights, we've got these kind of leadership points. One of them is hold nuance. So, for example, global and local. So moving between perspectives. So those are the kind of points that I've been picking up on.
And I just like.
Sorry, David. Please
2
go
seconds. On. Yeah. I'd just like to say, Pete, sorry, this is a really amazing, more than just a picture. This is a really good collection of some key points from it. Thank you. Sorry, Catherine.
Thank you.
No. I was just going to say, I think you and I had exactly the same brain moment, because I was going to say exactly the same thing. Pete, thanks so much. That's great. I want it for myself. I might print it and put it on my wall so that I remember what to put in my briefs.
Yeah, fantastic.
Thanks so much.
Cheers.
Really lovely to have you here. Thanks, everybody. It's been a big day. I am so grateful to have had Claire and Sammy here to talk about long COVID. Thanks to Scott, who talked about all the work the engineers are doing. Thanks to everybody who was around. Really appreciate everybody's time. Really looking forward to seeing you in 2 weeks. Have a great evening, morning, afternoon, wherever you are. Stay safe, wash your hands, wear your mask. Don't be afraid to be the only person in the room who does it. We want to see you here again next week, 2 weeks from now, and not hear about you being sick. Thanks, guys. Happy Friday.